Hello, everyone. Welcome. Today we're going to talk about diabetes burnout. I'm Cynthia Turcotte. I have a PhD in psychology. I'm also a clinical psychologist in private practice. I'm specialized in health psychology with children, adolescents, and adults. I'm also a lecturer at UQAC, Université du Québec à Chicoutimi for the doctorate in psychology. Finally, I'm a clinical collaborator in the BETTER project, which aims to measure and reduce hypoglycemia in people living with type 1 diabetes. So it's a pleasure to be with you today. You can ask your question by typing them in the chat while I'm speaking, during the presentation, or at the end, depending on your preference. I will try today to answer the following 4 questions during the presentation. First one, what is diabetes burnout? How to identify it? How is it possible to prevent it? And how to cope with it? First of all, we'll try to understand what is diabetes burnout exactly. For some, the diabetes treatment may seem very simple. All you need to do is meet with the healthcare team regularly, take your insulin every day at the right time, eat according to your nutritional recommendation without cheating, check your blood sugar levels regularly, and do physical activities so as to achieve a balance to keep blood glucose levels within targets. It seems so simple, but really, it's the notion of balance that makes us realize that living with diabetes is not easy at all. Living with diabetes can be very frustrating and difficult. It's not just a simple matter of eating right or taking a medication properly. Diabetes is often an emotional struggle as well. Indeed, addressing and overcoming the emotional stresses of diabetes may be one of the most important steps you can take to manage the illness successfully. So unfortunately, it is too easy for both patients and doctors or healthcare professionals to neglect this personal side of the illness. So we see there a lot of emotion. We can deal with it while self-managing our diabetes, so you can live stigma, stress, hypervigilance, or anxiety, depression. So it's a lot to deal with. Self-management of treatment, diabetes, and its possible consequences in a balanced way while experiencing all this emotion can therefore lead to diabetes burnout. On the road to diabetes exhaustion or diabetes burnout, the first person who has talked about diabetes burnout was the author Williams Hoover. According to her, it is an inability to take care of oneself due to mental and physical exhaustion. It is as if a door has closed in our brain and prevents us from accessing the place where all our knowledge of diabetes care and management is carried out. It's no more possible to access it because our body can no longer bear the effort of moving systemically from different emotions, a good emotion, a difficult emotion like being proud of ourselves or guilty because of the diabetes treatment we don't follow very well. So we no longer tolerate being in this movement of a dryer in a slow motion that never stops. Being burned out means that you are tired of all you have to do and think about to try and hit your blood sugar targets, to try to do your treatment. Diabetes burnout is characterized also by feelings of mental, emotional, and physical exhaustion related to living with diabetes. Now, burnout is currently not considered a diagnosis according to the DSM-5 used in North America. It is often identified as an adjustment disorder by our doctors here. While in the International Classification of Disease, ICD-11 in Europe, burnout is recognized, professional burnout. And it is considered as a factor influencing the state of health of people in employment or unemployment, with three dimensions very important, including the feeling of exhaustion, mental distance or cynicism, and reduced professional effectiveness. So we can compare diabetes burnout to a professional burnout, but it's not an official diagnosis here in North America. So diabetes burnout exists mostly because the self-management of diabetes is as hard as work with no immediate visible results. So we don't know exactly how many person with type 1 diabetes suffer from diabetes burnout. We don't have enough results from research about diabetes burnout, but we think it's very common. According to two studies, it appears that 36% of people with diabetes identified exhaustion due to diabetes as a barrier to self-management behaviors and medication adherence. Another very well-known study, the Down study, says that along with depression, anxiety, and stress, diabetes burnout is listed as one of the main psychosocial complications of diabetes. And it's 60% to 74% of healthcare providers who say that. So it's very, very common to be burnt out. We also know, thanks to some facts taken from the BETTER Registry in Quebec in December 2019 on type 1 diabetes, that most people living with type 1 diabetes, although all of them are mostly insulin treated, use different treatments adapted to their situation, either the pump, the pen, or the syringe, or both. And with these treatments, not always easy to live with on a daily basis, and despite access to new facilitating technologies, the fact remains that patients reported an average of 6 to 7 episodes of hypoglycemia in the last month. So it is therefore a fact that perfect control of diabetes is not the norm. It's a work, and it's a hard work with not so easy good results. In addition, this work of self-management of type 1 diabetes and its treatment, it's to be done throughout life. It begins as soon as a diagnosis is announced, and whether in childhood or adulthood. We know it's possible to be diagnosed with type 1 diabetes around the age of 40, for example, and this until the end of his life, yes. It is as if you had to exercise a job that you did not choose and without ever being able to change it or leave it. And now I don't see any questions, so I will continue with my presentation. Oh, sorry. A little technical challenge here, so we're back. Okay. And it must be added to this that no vacation is possible from the treatment without suffering serious health complications, whether in the short, medium, or long term. Finally, we understand that diabetes burnout is not a sign of weakness, but rather a sign that we have been strong for too long. And some patients said to me that it's not only throughout our life, but it's throughout each day. So it's a big effort throughout all the day also. So how can we identify diabetes burnout? How to know I'm burned out? So to find out if you are fighting diabetes burnout, questionnaires exist with around 10 easy to answer questions. For example, the screening questionnaire available online can help you think about diabetes burnout. Do you feel overwhelmed and defeated by your diabetes? Do you feel like your diabetes is controlling your life? Answering these questions as spontaneously as possible can allow you to realize if you're exhausted and to open the discussion about diabetes burnout with your healthcare team. So this questionnaire will be available. I think my PDF for my presentation will be available from BETTER shortly. You can consult the question and maybe think about it and make your own answers. Another way to think about diabetes-related burnout is to be aware of possible patterns of exhaustion. There is a continuum from a milder exhaustion or feeling burnout to a more severe exhaustion of being burned out. So indeed, the authors of a recent qualitative study proposed 4 distinct profiles. The first one is to be engaged without feeling exhausted. The second one is tired. So you feel tired, but you're still engaged in your self-management. And the third one, you feel disengaged without feeling tired. And the last one is feeling exhausted with detachment, you're at this point, you're really burnt out. So the patient may experience, and it was from the experience of patient with diabetes, with type 1 diabetes, that the authors create this 4 profiles measure of exhaustion. A research team has developed also a questionnaire related to this continuum to better assess diabetes-related exhaustion. The questions asked concern 3 main dimensions of diabetes burnout. The first one we see here is exhaustion or tiredness. So fatigue. I'm mentally tired by having to think about my diabetes all the time, for example, or taking care of my diabetes is physically draining. The second dimension is the detachment. For example, I try to think about my diabetes as little as possible. When it comes to my diabetes management, I do the bare minimum to survive. So again, you'll have access to these questionnaires, and it can help you to think about you and how you feel about your diabetes. The last dimension here, it's a new one, and I think it's very interesting because I hear often patients who says that they don't feel like they control their diabetes. And for example, here we have the question, there is nothing I can do to manage my diabetes, so why bother? I struggle to stay on track with my diabetes management. I have to force myself to continue managing my diabetes. My diabetes is out of my control. So it's important to see that loss of control here is a part of diabetes burnout. Feeling like you are able to do your self-management, so it will very help you to deal with exhaustion. So here, the same team of researchers has established that diabetes burnout, psychological distress related to diabetes, and depression are linked and have common manifestations and symptoms while being distinct entities. Diabetes-related psychological distress is defined as the negative emotional impact of living with diabetes and its treatment. experienced by the person with diabetes. Psychological distress or diabetes distress would be associated with not optimal self-care and with difficulties to achieve glycemic targets. The diabetes distress and diabetes burnout were characterized by more specific symptoms related to that type 1 diabetes than depression. Fear of hypoglycemia, for example, was most commonly seen in relation with diabetes distress. So when we have any hypoglycemia, it can be very difficult to feel that you don't. Sometimes we fear we will have another hypoglycemia after living through one who has been very difficult for us. So both diabetes distress and depression were described as a negative mood, and guilt and loneliness, and they have that in common. The results of their study of the researchers suggest that although there are overlaps between depression and diabetes distress, these appear to have be different. Mostly it can be related to other area of your life, other difficulties than diabetes, and distress as an ongoing response to difficulties in managing diabetes. When comparing the studies assessing depression and diabetes distress, few studies have addressed diabetes burnout. So the results from the study highlight the need for more research on diabetes burnout to distinguish from diabetes distress. I can add here that diabetes burnout have in common with depression, the fatigue, everything seems to be like a mountain. Or the person wants to sleep a lot, or the fatigue is something common here between diabetes burnout and depression, but we have to learn more about that. By the way, you can see a very short quiz from Polanski book that I use for this presentation. So the reference will be at the end of the document and the presentation. So this short questionnaire seems to be about diabetes burnout. They ask, how exhausted are you in the last month? But in fact, they are interested here in distress, psychological distress related to diabetes burnout, because you have to note here that they are asking to indicate the degree to which each item may be bothering you in your life, not whether the item is merely true for you. So, for example, feeling that diabetes is taking up too much of my mental and physical energy every day. Is it for me a serious problem, a moderate problem, not problem? You can feel more distress about being exhausted for good reasons than another person. The other example, feeling burned out by the constant effort to manage diabetes, feeling that I'm often failing at diabetes regimen. Okay. So it's not only about burnout, it's also about distress, psychological distress about being or feeling burned out. You have the result categories here. You can use them to count your total score and know which category represents your score. And you can find that also in this, again, in this book from Polanski. The book is Diabetes Burnout, What to Do When You Can't Take It Anymore. The third question I will try to answer today is how to prevent diabetes-related burnout. Is it even possible to do that? Sorry. Because type 1 diabetes is a chronic, incurable condition that can be lived with for a lifetime with treatment, it is difficult to prevent burnout from occurring. It is nevertheless possible to better understand the personal and interpersonal barriers to healthy self-management of diabetes that can contribute to burnout, and take them into account as best as we can to prevent exhaustion as much as possible. So we'll take a look at the personal obstacles that can be in your way. It is very important to think about potential personal obstacle that can lead you down the road to burnout, to diabetes burnout. What are the personal obstacles that could be in your way? Will this be chronic depression, maybe from other event in your life and other episode you've gone through and you went through and you were depressed? Maybe it will add the risk that you will deal again with depression, and what impact will it have on your diabetes self-management and maybe in your fatigue, also your exhaustion. The other personal obstacle is having or adopting emotional rather than solution-focused coping style. What it means is you want to avoid problems and difficult emotion by, going to cinema, looking at TV, reading a book. You try to not feel the emotions, the difficulties, and you try to not look at the problems really, instead of trying to solve them or being able to feel the difficult emotions that can lead you to try new strategies or to try new things to help you through dealing with diabetes. The other obstacle could be, will I be at risk to have an eating disorder, for example, and to be very frustrated or have fear with my weight management. Maybe the lack of knowledge about diabetes. We have a lot of novelties about treatments in diabetes, always each year. So we think about the pump or taking glycemia with a new device and continue information about our glycemia. So you can have this obstacle on your way, and you have to think about it. What will I do? Will I want to learn more about diabetes? Another obstacle is the inaccurate health beliefs. Sometimes when we feel tired and we don't anymore want to do our diabetes, many people around us will judge us, and they will think that we don't care anymore, that we don't want to help ourselves. And so those inaccurate health beliefs won't help you. The negative feelings about diabetes, being frustrated. For example, I have persons in mind, they said to me that diabetes is the best disease the best condition it could have. They are dealing with that very easily, but for other persons it's worse than having cancer, and it depends really on the history of the family history of each person or the personal history of each person. So you have to think about that. Will it be an obstacle for me? The fear of low blood sugar, fear of hypoglycemia is very common, and will I have to deal with that? And the last one, I already talked about the fear of frustration with weight management. And here we have also, at the end, the unrealistic or unclear expectations about self-management. I have heard many persons who talk about the fact that they want to be perfect in their treatment and the way they deal with diabetes, but that's not possible. We are human, we have limits, and that's normal. So we have to be clear about what we will be able to do and what we won't be able to do about the treatment. Among other things, it is very important to maintain realistic beliefs about the treatment of diabetes and exhaustion. For example, of realistic beliefs that can help you to prevent maybe exhaustion is not thinking about yourself as if you are unmotivated to take care of you or your diabetes. Everyone I know as a patient with the type 1 diabetes they all want to take care of their diabetes, even if they don't do it very well. And that's important to stay kind with yourself while going through all the challenges on the road of diabetes burnout. The second realistic belief is diabetes management has many long-term benefits, but few immediate ones. Here we can say that it's very difficult to maintain the effort all the way each day without seeing the results really. It demands a lot of hope and belief in the treatment, and that's not so easy to do, because the last realistic belief is no one feels motivated to do something if the costs seem to outweigh the benefits. So sometimes we have to create benefits to do the self-management each day. For example, I can say if I've done everything I've wanted today about my diabetes, in the end, I will see a good movie. That's a good way to deal with emotional oriented coping, but at the same time adding a solution coping. And having a realistic belief can help, again, to stay connected with the fact that you're human and that you have limits, and that's normal. Once here we have also, sorry, I went too fast. It is important to think about the potential interpersonal obstacle also in the way that can be in your way and can lead you to diabetes burnout. For example, you have to think about, will I live family conflicts in my life concerning my diabetes management? Will some person in my family will help me or not too much, not enough? And maybe not only my family, maybe my friends, maybe my medical team. So think about that. The other interpersonal obstacle could be family confusion about diabetes self-management responsibilities. Here, what I mean is that when you're young and you live with type 1 diabetes, parents are very, very present, and they help a lot with the self-management responsibility, but also with other period of your lives, you will experiment this with your spouse or with your children when you're older. So you have to be very clear with which responsibilities you will accomplish and you will have, and which responsibilities your loved ones will deal with. So the next one, the next interpersonal obstacle is the doormat syndrome. It's an appellation, it's a way to say by Polanski that some people, a lot of people with diabetes, they are very oriented to help others instead of themselves. And they have difficulties to say no to others when they are at a supper or at a restaurant, or to take another drink, or to take this kind of food, and they help a lot of other people. I think that and a hypothesis about that is that living through with diabetes since they are very young, they have maturity and concern about other dealing with pain or difficulties, and they know what they're talking about. So they are more often oriented to help other than themselves. So it's a possible interpersonal obstacles in your way, and you have to think, how I will deal with that, what place I will give to me and my self-management of diabetes. The last one is a poor alliance with physician and healthcare team. As a psychologist, I often hear patients talk about the limits, the difficulties they have with their physician, healthcare team, nutritionists, pharmacists, or nurses. And what I would like to say here is when you think about that, you have to think of a way to be assertive while using the I statement. I would like that, I prefer this, and with respect for in consideration of the limits of the other person. And you have to carry on to do that all the way through to have a good alliance with physician and healthcare team. So once the obstacles are well defined, it is then possible to anticipate the problem areas and then consider solutions. Here we have a little resume of the possible problems and solution you can think about to prevent burnout. It's from, again, Polanski book from 1999. So it's a very, in my opinion, it's a very up-to-date book, even if it's from 1999. And it says that we have a lot to know and we have to search more about diabetes burnout so we can help you to prevent burnout. But that's a good way to start. It's simple. 4 areas: diabetes self-management, attitudes and feelings, social relationships, and environmental stressors. So you have to choose which possible problems you can anticipate and which one are more important for you, and consider solutions to overcome them. You have to ask yourself which areas or which problems requires me more energy and lead me more on the way to burnout. So the last but most important, how to cope with diabetes burnout. So it's important to challenge, it's important to recognize that we are in the land of diabetes burnout. We already talked about the fact that, about how we can recognize that. But now that it's done, and you say to yourself, I can't take diabetes anymore, we have to challenge some myth about this country of diabetes burnout first. So a person with diabetes burnout is not a person in denial about their diabetes. Being in denial means that you are so in shock to have to deal with diabetes, to have diabetes and to have to do a treatment, that you really forget about it, like you're not living with diabetes anymore. It's more often seen at the first stage of after having been diagnosed with diabetes. But being exhausted and burnt out doesn't mean you're in denial. It doesn't mean you lack self-discipline also. On the contrary, you have done so much, and you did take into account all the way the diabetes, and now you're not able to do it anymore. Some people will say that person with diabetes burnout, lack of willpower, but it's, again, you have so much willpower that you have done too much and you cannot do it anymore. And last and very important is it doesn't understand the importance of that treatment. No, the person with diabetes burnout does understand the importance. The person didn't forget about that. It's just that the person cannot do it anymore. And she tried so hard. So the person doesn't try hard enough. That's not true. Like we have seen earlier in the presentation, it's because the person do so much effort each day. She tried too hard. So 3 things to know if you are exhausted. You have to remind yourself to help prevent diabetes burnout and to deal more easily with diabetes burnout. You can say to yourself, you know, as a psychologist, what we say to ourselves is very important. And you can say, I'm not alone. You can talk with other people with diabetes. They will say the same as I say today. They will say, yes, I'm dealing. A lot of things can get me exhausted. It could be a hypoglycemia. It could be acidosis. It could be hyperglycemia. It could be being afraid to have hypoglycemia. It could be a lot of things. But so being exhausted is very common. You're not alone. Also, you're not a bad person. You still want to take care of yourself. You still want to do your best. And very often you are trying to do a lot, and to be perfect. And that's very important that you say to yourself, I'm human, I have limits, and that's normal, and I'm a good person, as I always have been, even if I'm burnt out. And the last, you have to say to yourself, the situation is far from helpless. You can deal and cope with diabetes burnout. So the big question, how to get out of the country of exhaustion or diabetes burnout. First, you have to welcome and validate your emotions. Emotions are very concrete in yourself. They are physical reactions you can identify. And when you do that and you don't struggle with them and you don't refuse them, you can more easily find solution. And the difficult sensations and the emotion that are negative and that you don't want to feel, when you let them be, they tend to diminish by themselves. To learn that, you can use some meditation techniques. They can help you to learn to feel the difficult emotion and to observe when they come down, their intensity is less and less while the time passed. And it's a learning process, but it's an important one because you have a lot of emotion struggle with that can lead you to, with diabetes, that can lead you to the road to diabetes burnout. The second one you can do is understanding that perfection can become the enemy of good. I think I've already covered that, but I can say it again. You are human. That's correct. It's impossible to have a perfect result with diabetes, and that's normal. You have to tend to a balance, but not to be balanced all the time. How to get out of the country of exhaustion. 2 important things is to connect with people who understands you. It could be on Facebook, on the social media, with other person with other disease or other conditions that can understand you. It will help you to feel less alone and to feel more understood. The other one is very important, involving your healthcare team to help you get through some period of exhaustion or from not doing what you can do about yourself and your diabetes. And the last one, focus on one problem at a time and try new solutions. When you're living in a lifetime with a condition like that, you have tried already a lot of strategies and a lot of solutions. I encourage you to be creative, to stay alert to new possibilities, so it can give you a little more energy to deal with diabetes again. Feels like it's a bit new, and that could be exciting in a way, but at the same time, go seek some help from your healthcare team while you're doing that, because you will need to learn and to have a period of trying. A period to try these new solutions, and focus on one problem at a time is very important, because sorry, I was too quick on this, but when you try to change a lot of things at the same time with diabetes, we don't know what is the real impact and what cause the good impact if we have it. So it's important to try one thing at a time to gain some energy and to help you going through diabetes burnout. A solution, temporary solution that is discussed by Polanski here is allowing yourself a safe vacation. To do that, you really have to speak with your healthcare team to know what is possible to do to relax a bit about diabetes treatment without causing serious health risk. This vacation will be temporary, of course, and you have to sometimes do that, because instead of letting all go away about self-management, diabetes self-management, you could really you need to step back a bit about the treatment without letting everything go away. So again, we see the potential problems, and it's from Prevalence again, and the new solution you can consider the 4 potential areas of problem: diabetes self-management, attitudes and feelings, social relationship, and environmental stressors. You can think about that while you're being burned out. You can look at those 4 areas and ask yourself, what is taking me more energy? And consider solution. How to do that? Polanski suggests that you determine the priorities. So top 2 of the most important barriers, and ideally keep 1 barrier from section 1, diabetes self-management, and 1 barrier from the other 3 categories. After that, choose what actions to take, 2 strategies for each obstacle you choose. And agree with that, for sure. That's important. Again, 1 step at a time is very important. You can try 1 strategy at a time for a period of 2 weeks, for example, and see if you have any results. So to conclude my presentation, I would say only that it's very important to recognize the experience of diabetes burnout. It's a normal phenomenon for each person with type 1 diabetes. And I encourage you to take care of yourself and to think about that. And maybe take a time to look at the questionnaires in my presentation and determine which obstacles are on your road to diabetes burnout and lead you to diabetes burnout. And yes, for your information, the replay will be available on this page of the BETTER website, and the PDF of the presentation will also be available under the video. If you have any question, you can ask them in the discussion right now. I still have 2 minutes to answer them. So I don't see any question. If you have some, you can also ask them on the BETTER website, I think. And I will say to you, have a nice day. And yes, we can conclude and take care of yourself. And I hope you will have, with this presentation, some tools to help you on the road to diabetes burnout. Thank you.